Hi, I'm Alicia Gonzalez, emergency physician and the director of clinical training at the Brave Center, a program of the Public Health Institute founded to make it easier for people to access healthcare when and where they need it the most. One of our main goals is to help people in our communities stop dying from issues related to drug and alcohol use. It's no secret that far too many people are dying from drug overdose and harm associated with substance use. And opioids are the number one cause of drug related death for our patients, many of whom were unknowingly exposed to opioids that were laced into stimulants and other drugs. While we here at Bridge know that we must make access to medication based addiction care accessible to every patient that needs it, we also know that creating a culture in our clinics and our hospitals, really meeting our patients where they're at and building safe spaces for them to seek care, is a crucial part of any successful overdose reduction program. So, to help us learn a simple, tangible, and super impactful example, let's hear from our Bridge Center's Josh Luftig.
When it comes to truly reducing the harms from drugs, getting naloxone into our communities is bar none one of the most effective interventions available. Naloxone is an opioid antagonist, which means it reverses an opioid overdose within minutes by blocking opioid receptors in the brain. It can be given as a nasal spray or an injection. It is so safe that in March 2023, it became an over-the-counter medication. Despite this accessibility, very few people actually purchase over-the-counter naloxone because of the stigma they encounter at pharmacies and because it's expensive. Even when patients receive prescriptions for naloxone after an opioid-related emergency department encounter, only 1% actually fill them. This is why direct distribution of naloxone is critical. Direct distribution means we put naloxone directly into people's hands, and hospitals are the perfect place to do this. Hospitals provide 24/7 access to care and reach our highest risk patients at their most vulnerable moments, like immediately after an overdose. Hospitals already offer essential services for substance use disorder, including medication to treat addiction, like buprenorphine for opioid use disorder, connection to social services and housing resources, and linkage to ongoing addiction care. Adding naloxone distribution sends a powerful message. We understand the challenges of addiction, and we're empowering you to be part of the solution. When we distribute naloxone, we're literally putting life-saving medication into people's hands, creating a bridge that keeps patients alive until they're ready for treatment. Setting up a naloxone distribution program is simpler than you might think. Step 1, assemble a small team, including a program director, an ED champion, a pharmacist, and a nursing representative. Step 2, create a standard operating procedure, which is a basic guideline of where naloxone will be stored, who's responsible for maintaining it, and how staff can access it. A sample is available on our website to help you get started. Your program can take different options depending on your hospital's needs. You can have in-hand distribution where staff directly provides naloxones to patients and visitors. This ensures a personal connection and education occurs. You can also have automated distribution, which involves self-service options such as newspaper stands and vending machines. This makes naloxone as easy to grab as a snack 24/7, 365. Step 3, train your team so they can serve as champions of your program. And remember, naloxone is uniquely safe, only affecting those experiencing an opioid overdose. This safety profile is why community distribution has existed across the US in places like schools, libraries, and syringe exchanges. And again, it's why naloxone was made over the counter in 2023. Very much like face masks, anyone, truly anyone in the hospital can take or hand out naloxone, and people can simply access it themselves at no-cost vending machines. Naloxone distribution is a fantastic way to empower your entire team to save lives. Finally, step 4, you need to access naloxone. While distribution programs are widespread across the United States, hospitals are often overlooked high-impact sites. Connect with existing programs in your area to involve your hospital, either as a site for that program to set up a distribution stand or to establish your own program. Many states offer grant programs to fully cover naloxone distribution costs, allowing you to provide naloxone completely free without insurance paperwork. Connect with your state Department of Health or Department of Human Services to find these grants. An increasing number of states are requiring insurers to cover naloxone distribution costs as well, and we're hoping to see that number increase. But for now, grants offer the most streamlined approach. You can also maximize the impact by adding a custom label to the naloxone you distribute that connects recipients to additional resources like navigation services or treatment options. Naloxone distribution is very doable, and we are here to help. Within the first 4 years of driving this work, over 200 hospitals have distributed over 600,000 naloxone units in California alone. That's over 500,000 chances to save a life, and that number is growing every day. Naloxone is the CPR of our generation. We need to make it accessible to anyone, anywhere, anytime.
Josh made it pretty clear. Naloxone saves lives. And distributing naloxone is a super easy way to engage your staff and community to help prevent overdose deaths. The right thing for patients is also the easy thing for us in healthcare. Set up a naloxone distribution program in your hospital today, and let's work together to save some lives.